Yan. Okay, so to start, okay, first let's talk about amoebiasis. Okay, so this is caused by protozoa and specifically yung infectious agent niya is the Entamoeba histolytica or E. histolytica. It invades the large colon and secondarily in the liver. So secondarily affects the liver. Okay, so signs and symptoms, okay, definitely we have loose stools, vague abdominal pains, and third, occasional rectal bleeding. Now, to add some other details, yung wala sa slide, okay, for you to see. Dumaan naman kayo sa microbiology na may ganun kayo na subject?
Yes, ma'am.
Okay. So just to just a recap. Okay, so just a recap. Okay, so the other spelling pala ng amoebiasis is yung may O. Okay, so again, it is a condition in which your intestines become affected by E. histolytica. Okay, so they live in the large colon, okay, without causing damage to the intestine, but then in some cases it will affect the colon wall, causing colitis or infection or inflammation of the colon wall, acute dysentery, or long-term chronic diarrhea. Okay, so this infection can also spread through the bloodstream to the liver. Okay, so major organ that will get affected by your amoebiasis is the liver. Okay, so this is transmitted by the fecal oral route, but it can also be transmitted through indirect contact with dirty hands or objects as well as anal oral contact. Okay, so ito siya. Okay, medyo special din itong disease for me because just like most children, I also experienced this years ago nung kinder ako. Okay? And it all started when I tried drinking yung fountain water good sa Stella. 'Di ba may mga drinking fountains noon? Okay? So, um, it started from there. Tapos, very immediate yung effect sa akin. Like, just a few hours after I drank from the fountain water, bigla ako nag-vomit sa class. Not just once, but twice, no? And then, from there, I was sent to the clinic and then I got admitted for the first time. So, for some reason, I still remember that incident even years, even even after so many years. Imagine kinder ako that time. Tapos grabe yung feeling ko. Okay, it was so traumatic. Okay. And okay, so that's just a background for your amoebiasis. Yung another common term for this one. Okay, so 'di ba for those who have been admitted in St. Mary's, no, or during sa time ko din as a student nurse, usong-uso yung AGE or yung acute gastroenteritis. Okay, so that was another term for, parang siyang general term for uh, all the all the GI problems back then. But then amoebiasis falls under that. Okay, so pinaka-i-watch out natin, okay, for kids affected by this disease, syempre yung dehydration because of the amount of loose stools that will be passed out. Okay, so grabe ka-strict dapat yung intake and output monitoring basta GI, yung GI na case plus pediatric ang patient. Okay, so for your dietary management, definitely you're going to have clear liquid diet. So tea, ginger, or salabat. Okay, so next we also have to observe bland diet and low residue diet. Why? Because uh, you want it to be less irritating to the GI tract of the patient, especially if rectal bleeding is present. Okay, so to prevent amoebiasis, okay, so you have to observe proper personal hygiene. Next, you also have to observe sanitary disposal of excreta. Okay, so this is also another common finding din sa mga low income or disadvantaged communities they don't have a proper um, wherein they don't have proper um, toilet facilities. Okay. Next, definitely have to instruct or observe frequent washing of hands. Okay, and then it's not just with water. No, you have to do the proper hand washing with soap, water, and then alcoholize or sanitize. Okay, so dapat complete the full package when you're doing hand washing. Next, boil drinking water because chlorination will not destroy um, your causative agent, but boiling will do. Okay, again, the act of boiling is uh, one of the proper infection control uh, or sterilization techniques that you can observe. Okay, and especially when it comes to food preparation. Okay. Next, let's proceed to influenza A. Okay, again ha guys, for those who just came in, I already posted this on your Quipper accounts. You just have to access it. Okay, it's 40 plus slides. Okay, all in all. Okay, so to continue again for your influenza A or your H1N1, this is another type of influenza virus. Okay, and this can cause highly contagious respiratory disease. So causes, we have viruses, in the influenza viruses that infect the respiratory tract and result in nasal secretions, a barking like cough, decreased appetite, and listless behavior. Okay? So ito siya, I also remember this from my student nurse days, yeah, early mga 2000s yon. Okay, and then meron outbreak ng influenza back then tapos of all the times no kanang case presentation na week. So imagine ha kanang 1 week we had 1 week to prepare for our case presentation because of this outbreak. Like literally no when the news came out na may influenza breakout, I think that was the bird flu one. Okay? Nag-announce yung school, gi-pull out nila yung mga student nurses from duty in SPH, and then they announced na no class. Okay, so no class. Okay, so all students are instructed to go home. Okay, so na siya kanang in a way parang siya kanang vacation for 1 week, but then a little bit later during that vacation na-feel namin again yung sense of dread and anxiety kasi magpe-present kami ng case presentation. Okay, right after that 1 week of um 1 week of being away from school. Okay? So, as for the mode of transmission, this can be easily spread from person to person through coughing or sneezing. That is why it is a must to practice yung proper cough hygiene. Okay, so you have to cover your mouth. Okay, so either with a handkerchief or let's say na you're not wearing a mask at that time, yung ginagawa ng iba, me included, I would just sneeze into my shirt or into my uniform. Basta hindi jud siya ma-spread dapat. Okay? I think you're familiar din with that picture of a person sneezing tapos yung slow, yung not sure if how you call this, but yung high definition or slow-mo photo ng person na who just sneeze tapos makita mo talaga yung gaano karami yung droplets na nasa spread. Okay? So again, you have to practice yung proper cough and hand washing. Okay, so to prevent this spread. Okay, or yung pinaka-best kay wear mask, especially if you know that you are coughing or sneezing, so to protect others from you, okay, and to also prevent spread of the flu, better na mag-wear kayo talaga ng mask. Okay? So, signs and symptoms, okay, so which are similar to the symptoms of flu for your H1N1. So, you have your fever, fatigue, okay, lack of appetite, sore throat, diarrhea, nausea, and vomiting reported in some cases. Okay? You also have headache, muscle or joint pains, runny nose, and cough. Okay? Okay, so that's it for this slide. Okay, no need for me to read the side the no, the side notes because it's naman self-explanatory. Okay, and you already went through your microbiome. Now let's focus on the dietary management for flu. 'Di ba, no? Basically, whenever we would feel unwell, especially if you're having cough and colds, no? Parang ang sarap mag-inom ng mag-consume ng yung hot fluids like yung sabaw. Okay? So, here we have broth. Okay, so you're going to give broth of chicken, beef or vegetable. Okay, so broth is one of the best things that you can eat when you have the flu. Kasi comfort food. Okay, and aside from that one, it has a lot of vitamins and minerals. Okay, so number two, chicken soup. Okay, so chicken provides the body with iron and protein, and you'll also gain nutrients from carrots, herbs, and celery. Okay, so all in itong si chicken soup. Okay, so itong mga hot liquids, both for broth and chicken soup, they are good for preventing dehydration. And then additionally, yung chicken soup is basically well packed. Okay, so you are not just preventing dehydration, but um, you're also helping the patient or helping yourself feel satiated or full. Okay, so good siya as in some preparations of chicken soup are actually very filling. Okay? So, nag-crave na kong soup ron. Okay? So next, you can also encourage your patient to take garlic. Okay? So garlic will enhance immunity and reduce symptom severity. Next, we also have yogurt. Okay, so alternate spellings for yogurt. There are some spellings na my H yung yogurt. Okay, so it can help soothe sore throat but can also boost the immune system. Okay, so next we have vitamin C containing fruits, which are important nutrients to help boost the immune system. Now, some fruits high in vitamin C include strawberries, tomatoes, and citrus fruits. Okay. Next, we have leafy greens like spinach, kale, and other um, vegetables. Okay, they are both rich in vitamin C and vitamin A. Again, for boosting one's immunity. Okay, next we have broccoli. So eating just one serving will provide immune boosting vitamin C and E along with calcium and fiber. We also have oatmeal, whole grains, okay, which are a natural source of immune boosting vitamin E. Okay, and we can also encourage the patient to have spices, pepper, and horseradish, which can help break up congestion. Okay, so additional note, yung for number 8, for oatmeal, it also contains polyphenol antioxidants and it has immune strengthening beta-glucan fiber. Okay, so magic word, magic, uh, basta oatmeal, okay, it is a good provider of fiber. Okay, so it will help you feel full as well. Okay, so next, okay, still under your your influenza type, your H1N1, staying hydrated by drinking water and fluid sources. Okay, so top one, para hindi maluya. Okay, well, one of the top tips to remember when if you're having the flu, okay, para para hindi maluya, para hindi din maluya, okay? You can also have broth, ginger tea with honey, honey and lemon tea, okay? And the foods to be avoided, alcohol, okay, caffeinated beverages, hard or jagged foods, and processed foods, okay? This is because they are quite irritating, especially when it comes to their texture. Okay, so if you are suffering from sore throat na related to the flu, okay, or if you have a patient um, who is experiencing flu, okay, and you would want to give him or her yung mga less irritating foods. Okay, so soft. Okay, so para hindi ma further irritate yung throat ng patient. Okay? Now, aside from this one, okay, another reason why you need to keep your patient well dehydrated, it's also because it acts as a natural detox for the body. Okay, so that it would be easier for the body to excrete yung waste products or uh, to help your body heal faster. Okay, basta well hydrated. Okay, this one. Okay, so another childhood disease, just like your amoebiasis. Okay, I'm sure some of you may have experienced this before. We have chickenpox. Okay, so it is a highly contagious and common viral infection among children with the causative agent varicella virus. Okay, so the mode of transmission, it is easily passed between members of families and schoolmates through airborne particles, droplets in exhaled air, and fluid from blisters or sores. Okay? So, itong si chickenpox, it causes an itchy rash with small fluid-filled blisters. Okay? So, special note, okay, so patients are contagious 5 days before and 5 days after the appearance of rashes and blisters. Okay, so basis natin for whether the patient is infectious or is contagious or not is yung presence ng rashes or blisters. Okay? Now, as for the chickenpox dietary management, so soft diet po tayo, but with the following specification. So, high-calorie diet. Okay, so you can give mashed potatoes, sweet potatoes, and avocado. So, basically, it's for fever and mouth infection. Okay. Secondly, we also provide a high-protein diet. So, this is for malnutrition prevention. So examples under your high protein diet for chickenpox dietary management are the following. So scrambled eggs, beans and lentils, tofu, boiled chicken, and poached fish. And then again, we have your bland diet. So these are chemically, thermally, and mechanically non-irritating foods. So you may give whole yogurt, kefir. Ito siya, if I remember well, parang ito yung special na cream I mentioned um, a few months ago when we just started our Nutri. Okay. We also have ice cream, cottage cheese, milkshakes, and smoothies. Okay. Basically, yung less irritating, not so spicy na food, not spicy food. Okay, or yung mga foods na less or less or zero in flavorings or spice content. Okay, what to avoid? We avoid giving toast, oatmeal, or hard, crunchy foods, popcorn, nuts, seeds, and fried foods. We also have to give non-acidic fruits and vegetables like applesauce, bananas, melon, berries, peaches, broccoli, kale, cucumbers, and spinach. Okay, so again, just be familiarized with these dietary management guidelines. Okay, so common siya sa board exam, yung mga questions on nutrition, especially proper food choices. Okay? Not just in the board exam, but for those who may want to take the NCLEX, anticipate na meron din talaga mag-appear na nutrition-based na na questions. Okay, but then ano siya kanang 'pag swerte mo, okay? Kasi with NCLEX yung time yung when I took mine, I was quite lucky na hindi nag-appear yung mga weak areas ko. Okay, so me personally, I'm quite poor in memorizing, especially yung mga different foods for nutrition. Okay, so I was quite lucky na walang lumabas na food choices, mga ganun. Okay, because the problem with one challenge sa NCLEX is that you have to be familiar din sa mga American foods. Okay, because it is an American based nursing exam. So may mga foods sa US na wala sa Philippines, not unless it was thoroughly discussed during your funda or your nutrition na subject. Okay? So to continue, you have to avoid spicy and acidic foods like chili peppers, hot sauce, salsa, garlic, grapes, pineapple, tomato, citrus fruits and juices, or foods pickled in vinegar, and even coffee. Okay. Next, for chicken pox sufferers, they have to avoid salty foods like pretzels, chips, soup broths, and vegetable juices because they may irritate or worsen the blisters around the mouth, and this can further induce itchiness and pain. That's why you need to avoid these foods. Okay, so basically in nearly every infectious disease, you have to observe vitamin C supplementation. Okay, so especially no back in the hospital, labi na pag post-surgery na case, even yung mga post-CS na cases, okay, so they really encourage or the doctors would often prescribe a vitamin C supplement. Okay, so it's either in multivitamin tablet plus vitamin C or as a separate tablet supplementation. Okay, hindi talaga mawawala itong vitamin C. Okay? Next, we have water therapy to compensate with high fever. And some hydrating beverages include plain water, coconut water, herbal tea, low sugar sports drinks, and electrolyte infused drinks. Okay? So, uh, yung mga fluids that you need to avoid, however, no? So you have to avoid giving sugary fruit juices, coffee, soda, alcohol, and energy drinks because the more sugar content in a fluid, tapos ino-offer mo sa patient, the more that the patient will might experience dehydration. Okay, so cut down on those food items. Okay? Wala, 68 pa rin. I wonder about the other students. Okay, or maybe affected sila ng net. Okay, for those na wala dito, kindly inform them. Dapat mag-show sila ng screenshot ng internet speed test nila. Okay, thank you. You like water, madam? I'm having a lesson. Okay, sorry for that. Ginaloki, bully ko sa akong mama. But then, naghatid siya ng food sa, sa office. Okay, well, anyway, to continue, we have dengue or your dengue hemorrhagic fever. Okay, so yung pinaka-danger that's associated with dengue is yung bleeding. Okay, so especially if nag-level up from the basic dengue to DHF or your dengue hemorrhagic fever. Okay, so dengue fever and dengue hemorrhagic fever are acute viral infections that affect infants, young children, and even adults. Okay, so the cause is a bite of an Aedes aegypti mosquito infected with one of the four dengue viruses. Okay, so mode of transmission again from bite of the uh, mosquito. Okay, with yung Aedes aegypti and Aedes albopictus. Okay, so these mosquitoes, they lay eggs in clear and stagnant water found in flower vases, cans, rain barrels, old rubber tires, and even sa mga canals. Okay? Okay, so these adult mosquitoes also rest in the dark. Okay, so ito siya. Okay, so basically, yung for prevention for dengue is to clear the area or to clear the community of sources of stagnant water. Okay? So for signs and symptoms, okay, so sudden onset of high fever, which may last from 2 to 7 days. Okay, so joint and muscle pain and pain behind the eyes. We also have weakness, skin rashes, nose bleeding when fever starts to subside, abdominal pain. Usually, no, some pediatric patients get admitted late, okay, especially when they start vomiting blood. Okay, so or yung coffee colored matter. Okay, meaning the patient or the child has been experiencing bleeding for some time. Kaya pag-vomit niya tapos medyo dark, especially yung dark coffee ground na pagka-dark, meaning um, prolong na yung bleeding niya. Nag-oxidize na yung blood. Okay? Kasi pag vomiting of red blood, a bright red blood, meaning fresh pa yung bleed. But then if they vomit out dark colored ones, meaning prolong na itong bleeding. It has been taking place already for some time. Okay? Aside from dark colored vomitus, okay, so your patient may also experience dark colored stools and difficulty of breathing. Okay, so for those who experience no your pre-clean or your ward assignments no labi na pag St. Mary's very common ito siya. Okay, so also during my time basta daan kami ng dengue na patient or patient with a known GI bleeding condition, yung one of the key endorsement details is no dark colored food. Okay, kasi we are monitoring for bleeding. So if mag-take ng dark colored foods yung patient, okay, so the bleeding might be masked by those coloring sa food. So no yung mga dark colored food. So this includes foods with tomato sauce, yung spaghetti. Kaya pag pediatric patient tapos dengue, it's quite kanang torture for them like if they would want to have Jollibee, spaghetti or mga similar foods tapos let's say may well-meaning na relative or family friend na mag-visit tapos magdala ng spaghetti, it's quite painful for them not to have their comfort food, especially if they are dealing with itong si dengue. Okay, so very very strict yung no dark colored food. So aside from yung mga spaghetti sauce, no, um, aside from spaghetti sauce, ibawal din yung cola, and also yung chocolates. Basta yung mga dark colored foods. Okay? Because it might mask the bleeding. Okay? So dietary management. Okay? So again, high calorie diet due to increased metabolic rate. So you would want to cope with the energy demands of the in the child's body. Okay? Also, high protein. Okay, so this is because of protein catabolism. There's also a fat restriction because of vomiting and diarrhea. Okay, because if you take mga fatty foods, yung mga fried, mga fried foods. Okay, this may um, further induce vomiting. Okay. Also, you're going to give sodium and potassium in large healthy amounts, okay, to replenish losses of these two electrolytes. Next, you also have a bland diet, okay, to facilitate digestion and rapid absorption due to reduced GIT motility. Okay? And then we also have high carbohydrate diet, okay, rather, because body stores of glycogen are quickly depleted in dengue cases. Okay, so kindly be familiarized with these dietary management principles for your dengue. Okay? So let's proceed to measles. So we have two types of your measles. Okay, so rubiola. It is a highly contagious respiratory disease caused by a virus in the paramyxovirus family, which normally grows in the cells that line the back of the throat and lungs. Next, we also have rubella or your German measles. So this is different from rubiola because it is a virus, because the virus that causes it is less severe. Okay? So that's just the key difference between the two types. Okay, so for mode of transmission, it is easily spread from person to person by sneezing, coughing, and close personal contact. Okay, so signs and symptoms of measles, we have the following. We have cough, runny nose, red eyes, or conjunctivitis, or sore eyes, sorry. The patient may also manifest fever, blotchy rash lasting for more than 3 days, and complications of your measles. Sorry, na wrong yung spacing niya. Okay, konting adjust lang. Okay, so complications of measles. Okay, we have the following: diarrhea, otitis media or middle ear infection, pneumonia, encephalitis, malnutrition, and even blindness. Okay, so you have to remember, no, yung measles, nakaka-affect siya din ng mga soft tissues. And one of the soft tissues include those that are found in our eyes. Okay, so that's why, as, since this is one of the common childhood um, diseases, key early detection, better prevention should be practiced so that hindi experience ng complications yung bata. Okay? Okay, so as you can see dun sa baba, okay, ito yung mga other key facts that you have to be familiarized with. Okay, so for measles, we have the 3C, so cough, coryza, or conjunctivitis. Okay, and sometimes yung complique spots. Okay, yung specific na lesions that you will see sa measles. Okay, and then the onset or yung sequence ng pag-start ng rashes. Okay, so basically they appear as flat red spots. They start on the face, particularly sa hairline, and then they spread downward and outward. Okay? Next, yung another thing to remember, yung related sa otitis media or ear inflammation. So it's the inflammation that starts at the epithelial surface of the eustachian tube, causes obstruction and secondary bacterial infection. Okay, so that's for your measles related na otitis media. Okay, next we have your measles dietary management. Okay, so we have high protein and high carbohydrate. So that's for fever and infection. Next, we have low fiber. Okay, so that is to treat the inflammation. We also still have vitamin C plus vitamin B6 supplementation that is to prevent infection complications and also to prevent convulsions, especially when the fever is um, quite frequent. And then definitely hydration therapy. Okay, so this is for fever, virus elimination, and so this acts as a detox and to treat dehydration. Okay, so those are your dietary management principles for measles. Okay, so we shift from the common infectious diseases to the more severe ones. Okay, so first we have acute respiratory distress syndrome or your ARDS. Okay, so by definition, it is an acute heterogeneous disease that causes an overwhelming pulmonary inflammation leading to severe hypoxemia and respiratory failure. Okay, so what makes your ARDS quite dangerous? It's because our alveoli, itong mga air sacs natin, they get filled with fluid. Okay, so this is classified as a restrictive lung disease with reduced lung compliance secondary to loss of surfactant function and atelecta- atelectatic regions. Okay, so this can be seen in both children and adults. Okay, and another danger, no, 'di ba, affected yung ating alveoli. So, as a result, your patient will be experiencing hypoxemia. Okay, so lack or loss of oxygen in the in the blood. Okay? So, once you encounter a patient possibly suffering from ARDS, okay, so they appear quite restless. Restless, where they also manifest pallor. Okay, kasi kulang sila ng oxygen circulating in their blood. Okay, so to further discuss, we have the etiology and risk factors. So, for direct factors, okay, tear drowning, pneumonia, okay, and also inhalation injuries such as excessive smoke inhalation, vaping, and factory fumes. Okay, and also aspiration of gastric contents. Okay, so this is also quite common sa mga babies, especially those who have just started breastfeeding tapos hindi ginapa-burp ng mother or yung mga instances na they're done with breastfeeding but then they let the baby lie down flat right away. No, no, yun siya. Why? Because it will cause aspiration. And when there's aspiration, the baby's lungs will take in the milk or the gastric contents. Okay, and this will induce itong si ARDS. Okay? Next, we have another thing. Ito siya, this is usually caused by illness or injury that may affect your client's lungs directly, okay, or indirectly. So, another instance of aspiration injuries, yung NGT feeding. Okay, NGT feeding, improper NGT feeding, sa assessment pa lang. Okay, so, uh, you have to be careful with your NGT feeding. Okay, so one of the main things that you have to remember is to check for the placement of the tube. Kasi if hindi ka nag-check ng placement NGT NGT ng patient, the end of the tube might actually be in the um, lungs and not in the stomach of the patient. Tapos kung maglagay kayo ng feeding, okay, so your patient will aspirate because of that. Okay? So, next we have yung mga indirect. Okay, so we have sepsis, trauma, pancreatitis, severe bleeding, and fat embolism. Okay, so these are conditions that can produce fluid in our lungs. Okay, so usually from fluid shifting, okay, and spread of microorganisms. Okay, especially pag septic ang patient. Okay, grabe yung um, infectious matter doon sa body niya. Okay? Okay, so we have clinical manifestation. So early, your patient may manifest or show anxiety and restlessness, breath sounds, okay, particularly yung mga fine crackles. They will also be manifesting cough, dyspnea, or the use of accessory muscles such during breathing. Okay, so makita nyo na labored ang breathing ni patient. Nahihirapan siya mag-breathe. Okay, the patient will also may also manifest retractions, grunting, and nasal flaring. Extreme tiredness and fast heart rate. So bakit fast ang heart rate? Because their body is trying to compensate for the low oxygen levels in their blood. Okay. Now for late clinical manifestation, so arterial blood gas will show respiratory acidosis and hypoxemia. Okay, so this is more on IC. This is delving into ICU territory. Itong si arterial blood gases, definitely you cannot learn this overnight. Tapos medyo complicated siya. This is something that you will learn pag third year na kayo. Okay, and I don't want to overload you with this one. Okay, so even me myself, itong how to how to properly interpret yung mga arterial blood gas, it took some time for me to to finally understand this one. Okay, so just take things one step at a time. Okay, so what do you need to remember? Kung ABG monitor, pag sa ABG, your patient with ARDS will exhibit respiratory acidosis. Okay, yung CO2. Yung CO2 is acidic, okay, in composition. And for your patient not to be able to excrete that CO2, it would make the lungs more acidic in nature. Okay, so next, breathing for your breathing in ARDS patients, they will manifest slow and shallow breathing. Next, they will also manifest cyanosis, so blue skin, lips, and nails, and then decrease sensorium, edema, frothy, pink sputum. Okay, itong si decrease sensorium, mahulog siya na medyo confused or disoriented yung patient nyo pag-assess nyo sa kanya. Okay, this is because of the low supply of oxygen circulating in the blood and ultimately to major organs such as the brain. So that is why pag med-surg na case, especially pag respiratory ang disorder ng patient, one of the things that you have to um, monitor is yung level of consciousness, because this will give you a good picture of the progression of the disease. Okay, so pag naga-manifest ng confusion or disorientation yung patient, this will tell you that uh, the patient's condition has deteriorated. Okay. Now for diagnostic procedures, okay, so chest x-ray or CT scan to be more accurate or to have a more detailed viewing. Arterial blood gas, okay, so ito siya, just another thing to mention, uh, this is one of the most painful blood withdrawal techniques. Okay, so you will learn this back during my time. Na-learn ko ito as part of phlebotomy training. Kasi during, yung dati kasi, especially if you are a newly licensed na nurse, this would give you a ticket to further training. So phlebotomy, blood collection seminars are one of them. Okay, so just like yung IV therapy na seminar noon, meron din kaming RD for this one. Okay, so magtinuslukay mo, kana mangita mo partner, tapos you're going to attempt to do blood withdrawal or blood extraction from the vein, and ito siya, itong si arterial blood gas. Okay, so what makes this quite painful is that, di ba, our arteries are hidden deep um, um, deep under the skin. So literally they are below our veins kasi yung veins natin mas superficial. And the deeper the blood vessel, the more painful yung pag-withdraw or kanang mangita jud ni dapat pangitaan jud ninyo ang blood vessel, especially pag artery. And you will know that you've hit the artery when blood will just simply go out by itself. Kasi 'di ba, arterial blood goes away from the heart. Okay, so once matamaan niyo yung artery, the syringe will just get filled by itself. Okay, no need for you to withdraw. Unlike sa pag-extract ng venous blood, you have to do the withdrawing on your end. Okay? Next, we also have bronchoscopy. Okay? So, diagnostic visualization of the bronchioles. Okay? Or the bronchus rather. Also, echocardiogram or ultrasound of the heart. Okay? So, this will check for any fluid present in the heart. Then, definitely physical examination. Okay, so for medical management, so this requires treatment in an intensive care unit. So there is no specific therapy that exists for ARDS actually. Okay, so the underlying cause should be treated. So let's say ang pinaka-cause is bacteria, like in the case of pneumonia. So definitely the patient will need to have antibiotic therapy. Okay. So for other supportive management, we have supplemental oxygen therapy. Next, you have positive pressure ventilation and mechanical ventilation. So ito siya, this is related to um, mechanical ventilators. And it's more on the respiratory therapy side. But then, if and when you get to experience yung ICU concept plus yung ICU na nursing, so definitely you will be exposed to this. Itong si positive pressure ventilation, this is one of the different settings in your mechanical ventilator. Okay? Ito siya, indication for mechanical ventilation. This is usually pag poor na yung level of consciousness ng patient, like from GCS score of 15, nag-down sila to 8. Okay, so this was also one of the key things that I had to remember no, during my NCLEX review. But for GCS of 8, intubate. Okay, 8, intubate. Okay, so they made use of keywords or rhyming words for us to remember yung mga certain key details in patient care. Okay? Basta nag-decrease ang level of ng patient, meaning there is already an ongoing damage in the brain. And the further the damage in your patient's brain, nakaka-affect siya ng mga basic um, functions in the body, breathing included. That is why you would always anticipate for intubation. Okay, so itong si intubation, especially when it is hooked to the machine, literally it is the machine, specifically the mechanical ventilator or your mech vent that will do the breathing for your patient. Okay? Next, positioning strategy. So, typically, pag ARDS, hindi sila pwede naka-flat. Okay? So, naka-high Fowler sila. Okay? To further promote better lung expansion. Okay? Okay, so next we have the dietary management of your ARDS. So for patients with tracheal intubation, meaning nakatubo sila, or intestinal nutrition tube indwelling, okay, oh sorry, for those patients who are intubated, definitely binibigyan sila ng tube feeding. Okay, so meron talaga silang nasogastric tube. Okay, so nutrition tube an indwelling nutrition tube or your NGT shall be recommended for feeding your patients who are intubated. Okay, so enteral formula shall be given to patients to reduce inflammation and promote healing. Okay, so you have to choose enteral formulas that are fortified with omega-3, EPA, and DHA, acids, and antioxidant nutrients. So ito siya, special timpla ito siya. Okay, so um, if the doctor will prescribe tube feeding for the patient, um, yung pagtimpla niya will be the care of the dietary service. Kasi sila din yung nag-distribute ng bottle feedings basta may ICU na patient na intubated. Okay, so imagine nyo lang, para siyang insure or yung milk na loaded with vitamins and minerals. Okay, some of those milk-based products medyo malapot. Okay, especially if you're taking care of a patient, tapos meron siyang underlying na potassium deficiency, it's quite a challenge to give banana-based feedings. Why? Because they are super slow. Like, you would have to wait for around 20 to 30 minutes para magbaba yung tube feeding from the bulbs from the bulb syringe going down to the tubing. Okay, so super slow muna siya. Basta banana-based ang bottle feeding through the nasogastric tube. Okay? So, itong mga feedings, they also contain supplement amounts of L-arginine or L-glutamine. Now, for ARDS patients who can actually tolerate tube oral feedings, yung mga hindi naka-intubate, they can have soft diet. Okay, so again, itong si soft diet, less irritating, it's also easier for the patient to tolerate. Now, however, itong si soft diet ng ARDS patients, it must be low in carbohydrates, high in EFA and DHA, itong mga fatty acids natin, uh, eco, eco sa eicosapentaenoic acid and linoleic fatty acids along with antioxidants and anti-inflammatory foods. Okay, so you need these nucleotides to improve cell function, modulate inflammation and reduce infection. Okay? Now, oral feeding must also be supported by oral nutritional supplements. So usually mga vitamin supplements like um, vitamin B complex tablets and multivitamins plus ferrous. Okay? So as to give your patient adequate nutrition. Sorry. Okay, to continue. Okay, so again, talking about oral supplements. So these can be given between meals or can be added to foods. But usually, naka-tablet form sila. Okay, so here's a samples of diet for ARDS patients. So for breakfast, thin porridge with flake fish, water or fruit juice. For AM snacks, they can have oral nutritional supplements. For lunch, veggies and fish soup, okay, water, fruit juices again. For PM snacks, oral nutritional supplements, and then for dinner, again, thin porridge with mashed pumpkin, tapos water and or fruit juice. Okay? Okay, next we have coronavirus or your COVID disease of 2019. So itong presentation na to, this was actually used starting from 2020 tapos kasagsagan ng COVID-19 outbreak. Okay, so ito siya. COVID-19 again, it's a contagious disease caused by SARS-CoV-2 and it is transmitted in three ways: inhalation, splashes and sprays, and the touching of your eyes, nose, and mouth. Okay, so this is airborne. Okay, this can also be contracted through airborne transmission such as intubation, tracheostomy, and suctioning of breathing tubes. So, very yung mga patients who, I mean, yung mga nurses who work in the ICU before, challenge masyado sa kanila back then. Why? Because they really had to go on full PPE mode, yung astronaut type na PPE. Okay, so goggles, gloves, mask, my gown, or yung special na suit, yung murag Teletubbies or astronaut sila tingnan. Okay, so those precautions were done considering the severity of the infection, lalo na pag respy ang case. Kasi any secretions coming from the patient and even yung mga droplets na gina-release ng patient, they give a high potential of spreading COVID-19. Okay? So for the incubation period, it's 2 to 14 days. Tapos yung mga at-risk populations are the following. So older adults, okay, especially those with health conditions that affect immune system. Okay, so cancer, diabetes, HIV, chronic kidney disease. And also, high risk din yung ating mga um, yung mga neonates, mga babies, or other young children kasi their immune system is still not strong enough to withstand or protect against COVID-19. Okay? Okay, for signs and symptoms, you have sore throat, adusha, and anosmia. Okay, so inability to smell, inability to taste. Okay, other signs and symptoms include nausea and vomiting, headache, congestion or runny nose, and diarrhea. Okay, so these are the key signs and symptoms under your COVID-19 infection. Okay, next we have your medical management. Okay, so there was no definitive one size fits all treatment regimen or treatment mode for COVID. Okay, so basically they do symptomatic treatment to manage an infected person's symptoms. So the use of antivirals, use of IV fluids to prevent dehydration in the patient. Okay. Next, in the National Institute of Health or NIH developed the COVID treatment guidelines to provide clinicians with extensive evidence-based recommendation for clinical management of COVID-19. Yeah. Mm, thank you. Okay. Next, we also have oxygen therapy. Okay, matik basta respiratory ang case ng patient, anticipate giving or preparing oxygen therapy. Okay, so I'm sure you had this din during your fundamentals. So itong si oxygen therapy, it could come from the traditional type, yung nakatangke ang oxygen, or the wall mount type. So oxygen supply is already installed in within the wall. Okay, so wall supply may mga tubes sila. Okay, and then you're simply going to um, connect it to your oxygen delivery device and then switch it on. Okay, to the prescribed rate of your oxygen therapy. Okay. Advanced respiratory support. So this includes mechanical ventilation for critical cases. So yung act of intubating patients. Okay? So especially if your patient is clearly deteriorating, naga-loss of consciousness siya, tapos at any instance, your patient will experience arrest or um, stopping of breathing. So that is why they need to be intubated so that the machine will do the breathing for them. Okay. Next, you have your medical management. Okay, so it's the use of antiviral or remdesivir for conditional treatment of COVID-19, which was US FDA approved. Another common medication that you will encounter is dexamethasone. So this helps reduce the length of time on a ventilator for severe and critical cases. Okay, so ito siya lung medicine. Okay? The first COVID-19 vaccines to be administered outside clinical trials were given in December 2020, then in the UK on the 9th, then in the United States on the 14th. Okay, so history. Okay, um, okay, so next, saan na tayo? Okay, so ito siya, yung specific talaga for COVID cases. So, sa assessment pa lang, especially sa ER or sa triage area, pag suspected COVID case, ang patient, number one, that the assessor needs to do, usually on the part of the physician doing the checkup, initial checkup, okay? And also for us nurses din, okay, so we have to get a thorough travel history, okay? Next, physical examination and documentation of the onset and progression of signs and symptoms. Vital signs monitoring, especially temperature and respirations, monitoring of oxygen saturation. So, another equipment that you would really need to have sa mga para kits ninyo, and I appreciate those students na may dalang mga pulse oximeter. It is to monitor O2 sat in your patients. Okay, especially pag nasa ward kayo tapos you were able to pinpoint patients na may respiratory dysfunction. Okay, so to give you a better picture of the patient's condition, having a pulse oximeter a key equipment to have. Okay, so basically normal oxygen saturation sa bodies natin is between 95 to 100%. Okay, so anything below that, meaning there's something wrong with the delivery of oxygen in the patient's body, especially pag respiratory ang case. Okay? Usually, no, back when I was in the gynae ward, may mix kasi kami ng mga ICU cases doon sa ward namin. Okay? Um, ano siya kanang, basta mag-decrease to line of 8 yung oxygen saturation ng patient, super hangak good ang patient. Okay, so very restless, labored ang breathing, like, tapos literally nagalagum na sila. Okay, so, they would either manifest yung pallor or yung cyanosis, like grabe sila jud man, no? Kanang they would have darkened skin tone because of the lack of oxygen. Okay? So, next, observe and enforce strict hand hygiene, do patient education, and prompt and thorough documentation. Now, for the dietary management, okay, so for COVID cases, so we give them low carbohydrate diet but high protein diet. Okay? And then neutropenic or low bacteria diet. So meaning nito is as much as possible you have to prevent your patient from getting further infections. Okay? So common neutropenic um precautions, okay, hindi sila pwede ng mga raw, like mga raw salads, okay? Dapat cooked yung food nila because yung mga raw, uncooked na food, especially in salads and yung mga raw fish, okay? So those food items may contain harmful microorganisms. Tapos infected na daan yung patient ninyo, down yung kanyang immunity, okay? So you have to prevent further infection from happening. And that's why we have itong si neutropenic na management. Okay? Another example of neutropenic management, although hindi siya related sa diet, you have to avoid having plants or yung mga flowers dun sa room ng patient. Why? Because they may harbor microorganisms. Okay, so this is a common board exam question. Usually it goes in this manner, like you are dealing with a cancer patient or any other patient na immunocompromised. Tapos what are the items that you have to avoid bringing inside the patient's room? So pag neutropenic management or neutropenic precautions, no talaga sa kanila yung mga plants. Okay, plants, mga flowers sa vase, yung mga items that have a high probability na may dalagod silang mga infectious na organisms. Okay? So that's for your neutropenic management. Okay. Can you just give me a few minutes? A few minutes, just drink water, or some of you might want to stand up a bit, stretch, go to the CR. Okay, 5 minutes will do. Anyway, the last remaining slides, we only have a few remaining slides left. So, 1, 2, 3, 4, 5, 6, ah, mga less than 10. Okay? Mga around mga 12 ito sila. Okay, so when you come back, we'll just wrap up the last slides. Okay, so wait lang, I also need to take a short break then. Mga 3 to 5 minutes will do. Okay? Amen. Okay, so recommended dietary prescription, okay, for COVID patients. So total energy requirement is 25 to 30 kilocalories per kilogram of body weight daily. Okay, so ito siya, this is on the dietitian's side. Okay, just be familiarized with this one. Okay. Total protein requirement is 1.2 to 2.2 grams per kilo body weight daily. For carbohydrates, we give 50 to 60% of non-protein calories. And for fats, 40 to 50% of non-protein calories. Okay? Okay, so much easier to remember. Okay, so we have to provide food items that are rich in nutrients and minerals such as vitamin C, vitamin A and B, carotene, vitamin D, B vitamins, folate, zinc with emphasis on bioflavonoids, probiotics, prebiotics, and resveratrol. Okay, so yung pinaka-key thing that you have to remember, dapat well-nourished and well-hydrated ang patient para iwas luya. Okay? But to combat the weakness associated with COVID-19. Okay, so we can give fresh and unprocessed fruits every day, such as fruits, vegetables, legumes, lentils, beans, nuts, and whole grains. Okay, and foods that are from animal sources. Okay, so proteins. Okay. Also foods that are filling for the patient, yung mabubusog talaga sila. Okay? And also to combat the loss of appetite that majority of COVID-19 patients experience. Now, for snacks, choose raw vegetables and fresh fruit rather than foods that are high in sugar, fat, or salt. Also, do not overcook vegetables and fruits as this can lead to the loss of important vitamins. Okay, but if you're going to practice yung neutropenic precautions, no sa kanila yung food. Okay, again, so you have to consider yung level ng immunity ng patient. Okay? Especially pag may cancer or may underlying condition siya na nakaka-affect sa kanyang immune response. Okay? So, be particular with the case of your patient. Pag hindi naman siya immunocompromised, pwede sa kanya yung mga raw. Okay? Next, provide food items that have known anti-inflammatory effects such as ginger, turmeric, garlic, bell peppers, and onions in recipes and meals. Okay? We can also give moderate amounts of fat and oil. Excessive use of salt and other condiments, however, should be avoided. Okay, so we can give unsaturated fats found in fish, avocado, nuts, olive oil, soy, canola, sunflower, and corn oils. We can also choose white meat, okay, so such as poultry and fish, which are generally low in fat rather than red meat. Okay. So avoid processed meats because they can be high in fat and salt, especially yung mga canned goods natin. Then, where possible, opt for low-fat or reduced-fat versions of milk and dairy products. So, avoid industrially produced trans fats. These are often found in processed foods, fast food, snack food, fried food, frozen pizza, pies, cookies, margarines, and spreads. So, ang daming mga comfort food dito. Okay? Okay, again and again, proper hydration. So give 8 to 10 cups of water every day. Fruits and vegetables that contain water, for example, lemon juice, diluted in water and unsweetened. Vegetable broths can also be given. Okay, so just some additional information. Strawberry are also examples of fruits that are rich in water. Okay. Avoid sweetened fruit juices, syrups, and fruit juice concentrates because they contain sugar and they can encourage more dehydration in your patient. Okay, less salt, less sugar. Okay, so quite self-explanatory. Okay, so again, this is to prevent dehydration in your patient. Okay. Limit your intake of soft drinks and sodas. Okay, balik-balik itong avoid foods that are high in sugar. Okay? Or if hindi talaga makaya yung craving for sweets, okay, you can use fresh fruits because fruits already have their own source of sugar, yung fructose. Okay? Medical nutritional supplements such as vitamin supplementation can be given. Food shall be generally at the minimum simple, easily or locally available, easy to prepare, can satisfy your patient's appetite, can provide adequate nutrition, and help boost the immune system. Okay, so these are nutritional goals for your patient with COVID-19. Okay? Nutrition care plan shall be individualized depending on the nutritional status of the patient and on the severity of cases. Again, care of dietitian sa hospital. Medical nutritionals or oral feeding is recommended to improve intestinal mucosal barrier and intestinal immunity and maintain intestinal microecology. And then avoid eating out. Okay, so ito yung one of the main things that we experienced during the COVID-19 pandemic. Okay, so uh, we we had to avoid eating out, okay, or meeting up with large groups of people. Okay, so it was safe back then to eat at home so as to reduce the rate of contact with people and to lower one's chances of being exposed to COVID-19. Okay, and then lastly, here is a sample one-day meal plan for COVID-19 patients who can tolerate solid food. Okay, so this is just a sample, okay, a model meal plan for your patient with COVID-19. Okay?